You're listening to Misunderstanding Dementia Podcast. This episode is brought to you by Misunderstanding Dementia Course, and you can put in 50 to get a 50% discount on the course. Thank you.
Welcome in our Zoom webinar. On the webinar part, there's a question and answer on the top. You can ask that any questions about this topic right now. And if you're in our Facebook group, in our ALZ Prime, again, welcome. And thank you for joining the ALZ Prime Caregiver Masterclass. If you're just watching live, just comment below, comment live. If not, comment replay at the end below. I really appreciate that. Put a like, put a heart. And that way I know if I'm helping you or not. So if you're helping me, if you feel like all this webinars are helping you, put down helping. So if not, if it's not helping you, put down not helping right now. Again, I hope you don't put that right. Well, anyway, today will be it's actually part of our Misunderstanding Dementia course. So today will be chapter 2. Part 1 of our Misunderstanding Dementia course. So chapter 2, part 1 will be the pathology of dementia. Gosh, I'm running out of English tonight. Well, anyway, what is pathology? Pathology is the science of the causes and effect of diseases, especially the branch of medicine that deals with the laboratory examination of samples of body tissue, diagnostic or forensic purposes. So basically, it's the study of the diseases, what's causing that disease. So that's what we're going to be talking about today or tonight. So again, this is just simple explanation about dementia. So where's my mouse over here? So dementia is actually an umbrella term describing a set of symptoms causing a person to have changes in the brain function. So dementia and Alzheimer's, they're not one, they're not one. The dementia is actually the umbrella, the symptoms. And then under that umbrella right here is Alzheimer's, vascular dementia, Lewy body, and frontotemporal. And, 50 to 75% of it is Alzheimer's. And that's why a lot of people correlate dementia and Alzheimer's, side by side, but it's not. Dementia is actually the symptom. And actually, Alzheimer's is actually the disease. So Alzheimer's is the most common type. And then next is the vascular. Vascular means, the arteries and the veins, and there's lack of circulation, decrease in circulation, like in stroke, and that can cause dementia. Lewy body is consisted of 10 to 25%. It's basically just like a Parkinson's disease, and it affects your rapid alternating movement, your back and forth movement of your muscles. And then the frontotemporal, 10 to 15%, wherein it affects your fronto and temporal. Fronto means the front part of your skull or your brain, the front part, and then temporal means your temple. It affects your your hearing and smelling and everything. So fronto is your executive function, wherein all the process of information, your behaviors and everything. And the temple is all your hearing and stuff like that. Okay. So next, we're going to be talking about, the Alzheimer's disease. Like what I said earlier, 60 to 70% of cases of dementia in older adult is likely to be Alzheimer's disease. Also noting that also sometimes we see overlap, meaning there's, you could have dementia, you could have Alzheimer's and also Lewy body. You could have frontotemporal and Alzheimer's. So it doesn't, you cannot just isolate one because it's a brain. And it's just a random thing there that will affect, is it the shrinking of the superficial part of your brain, or is it the shrinking of one side? Is it the shrinking of the inner part of the brain, or is it the shrinking of the frontal and the temporal? So it could overlap. So the behaviors and the symptoms that you see is gonna be overlapping. They could have difficulty in speech, difficulty in seeing, problems with smelling, problems with hearing, and stuff like that. So it's not just one thing. Unlike with stroke, you can just tell, okay, it's the right side of the brain that had the stroke, and it's the left side that is having weakness, and that's it. You can really identify it like that. Or a brainstem stroke, it affects just the brainstem. Or Parkinson's, it affects the basal ganglia only. So with dementia, it can overlap. Okay, it can overlap. And then next is it could be an inside use onset, which means it can be very difficult to determine exactly when somebody starts to develop the symptoms of dementia. It could be an early onset. It could be late onset. According to the studies, I haven't seen this, but there's as young as 12, 13-year-old kids that are having symptoms of dementia. I forgot the name of it, but it's called dementia because just the dementia alone, the dementia umbrella alone, we saw earlier, you only saw 4 here, but in reality, we've got dozens and dozens and hundreds of different types of dementia under it. So we're just talking about the most common, all this 4 here, but under this, you got other, other dementias like the Crutchfield dementia, the early onset dementia. It's not even there. The young children dementia that I was talking about earlier. So under the dementia umbrella, you've got hundreds of different types of dementia, and then they're discovering more. So the key here is understanding it. That's why we talk about misunderstanding dementia. So again, it is progressive and degenerative condition. So when I say progressive, it's gonna get worse. When it's hard to say this, but when you get a diagnosis of Alzheimer's or dementia, it is gonna get worse. We cannot prevent it from getting worse. What we can do is, change us as a caregiver, change our perspective and learning how to let go, learning how to adjust this into the situation. So that's my special challenge for you today. If you got a family member that has this, it's going to get worse. Now, another warning, a lot of people out there, I'm not saying this in a bad way, but a lot of people will say, hey, we've got the actual cure for dementia. And, this and that, this medication treats dementia. This medication helps with dementia and it cured me. Just to let you know, they didn't treat the actual Alzheimer's. They treated what you call the pseudo dementia, which is like, thyroid issues, UTI, dehydration. That could be a pseudo dementia, means it's not a real dementia. It looks like it's dementia. All right. So if it's a real dementia, it's going to get worse. It's going to be, it's going to be terminal. So if you see people telling that they treated, and reverse dementia, that's not real. Okay. All right. So again, it says here it's going to get worse and what is affected. So as you can see here in the picture, that older gentleman looks like he's losing his mind and stuff like that. But it is, it affects the brain, particularly the cortex, the whole cortex, the superficial part. If it affects the inner part, that's a different type of dementia. Or if it affects the frontal part or the temporal part, that's a different type of dementia. So with Alzheimer's, it affects the cortex and the superficial part. I don't know if you remember it. We showed a picture of a healthy brain, and then an Alzheimer's brain. It's totally shrink. The cortex of that brain has really shrink. Okay. So again, what is affected? It affects the memory. Obviously, it's a memory problem. It's a brain failure. It affects your circadian rhythm. Circadian rhythm is basically the rhythm of your body. They will get confused with the day. They will get confused with the night. They're awake at night and they're sleeping in the morning, and it just affects that. It affects their blood pressure. It affects their heart rate and everything. One day they're okay and normal, and then one day, the following day, they're not. It also affects the language difficulty. Remember, your brain function, when you're talking. Right now, this is not my first language. So I'm processing this very quickly in my brain and analyzing it and reading the slides and analyzing it. And then very quickly, I have to move my mouth, move my, voice box, and and express this English language to you. And it's very complex movement and information and coordination for my brain, my spinal cord, my nerves, my muscle, and everything. And that's the reason why they have this difficulty in speaking. It also affects the personality, their personality or their behaviors. One day they're very pleasant. The next day they're just bad and don't want to work with you, because it affects not only the shrinking of that brain, but also the chemical changes, the transmission of information in those neurons, the axon and the dendrite. Sounds fancy, but it's just the transmission of information in between those nerves or those cells. So just imagine, I got this wire here. It's a headset. So from here, the axon and the dendrite, it transmits information from here, and it transmits here to the wire towards where it's connected. And if that chemical movement here, that the electrical transmission here is not going through, you'll have personality changes, confusion. They're going to be confused with the time and the date, and if they did this or not. Just imagine you've got a filing cabinet, or let me get one of my book here. Just imagine you've got a whole book of stories in your life, and then you tear off one part, one page at a time, and their remaining other pages is what they got left, and they're going to get confused. They probably not remember what they ate this morning, but they'll remember what they ate 10 years ago, or when they were celebrating birthday 15 years old. And again, obviously decrease in higher cognitive function. Obviously, when that part of your brain is affected, you don't have cognitive executive function when you have Alzheimer's. All right, so next, this is actually discovered by Alois Alzheimer, however you pronounce that. And again, it affects the brain, the pathological changes of the brain. As you can see here, the healthy brain size is almost close to the skull. A shrunken brain with Alzheimer's disease is not rare, but a little bit shorter or smaller as compared to a healthy brain size. You see that difference there? It just affects, just like imagine, just like, a physical muscle, a skeletal muscle. If you're working out pretty good, just like me every day, right? No, not really. This is going to be big. If I don't use it, it's going to be weak, and I won't be able to lift the weight that I used to lift before. So it needs to be, when the muscle gets weak, it gets weak. Same thing with the brain. So here, this is the neuron right over here. The bottom part here says healthy neuron. That's a healthy neuron, just like the wire I showed you earlier. If it's a healthy wire or a healthy neuron, it can sense a transmission. Where's my mouse? It can sense a transmission from here, and it's going to go to another cell there. But if you've got Alzheimer's, the transmission of information is disrupted because of the plaques and some dying neurons and that neurofibrillary tangle. Sounds fancy, but basically, if this is the wire, this is the healthy wire, and there's some covering, some mud, some stuff that's not really blocking this wire here, and it's not gonna send a transmission. It's not gonna send my audio or video on this wire. That makes sense? Okay. So again, there you go. So this is like the neuron of a normal brain. It can send transmission. That's the cell. And then again, if you got the neurofibrillary tangles, it's not going to send information there because of the plaque and the blockage of the information. All right. So again, here's our summary. So there are many conditions which may cause dementia. The four most significant causes, obviously, is the Alzheimer's disease, the frontotemporal, Lewy body, and the vascular dementia. Vascular dementia is just, the arteries. So those are just the four most significant, but we have more, we got hundreds and more of different types of dementia. And again, Alzheimer's disease is a progressive and degenerative condition. It means it's going to get worse. It's just going to get worse. All right. So, and then Alzheimer's disease is characterized by the shrinkage or the atrophy or the getting smaller of that muscle of that brain. And it affects the cortex, the cerebral cortex, such as the frontal, the parietal here on the top part here, and then the temporal here. So it affects your frontal, your executive function, your temporal, your auditory, and your parietal, your movement and coordination or whatever. And then again, there are two hallmarks about the pathological changes of the cell or the neuron. It affects it it shows amyloid plaques. Basically, there's a plaque there, just like the plaque that you see in your mouth. It's plaquing that nerve, and then neurofibrillate tangles. Basically, it's tangled up. So it just sounds fancy, but it's just tangled up. And then again, amyloid plaques occurs between the nerve cells and compromise of an altered form of protein called beta amyloid. So beta amyloid, basically, it's just what you call this accumulation of that amyloid plaque. So just imagine again, this is the nerve. And if you got the amyloid plaque, just imagine you put some mud here and it's not transmitting that information. And then you've got neurofibrillate tangles. Right now, one part here is tangled. So it's affecting that transmission of information. All right. If you don't have any questions or any concerns, we'll stop the webinar. But if you appreciate this video, please comment helping me or whatever. We just wanted to know if this is helpful for you. And then before I forget, for those listening and watching right now, I still got 4 more left of this urgent medical notice card that we give out in our Alzheimer's Prime Masterclass. So it's called Urgent Medical Notice. Urgent Medical Notice Card. And at the back, it says, hello, my name is John Smith. You can put down your patient's name or your loved one's name. And also, we are going to send you caregiver Alzheimer's caregiver pin. So we'll send this to you. Okay. So I got 4 more. So let me know. Put down just private message your hello. What happened? Just private message your address, and we'll mail it to you, as long as you're in the US, okay? Not somewhere outside of the world. So again, God bless you. Have a great day. I wish you all the best. And always remember, this is going to be a big challenge, but always remember, the bigger the challenge, the bigger the victory. Again, I'll see you again next week. Take care and God bless. Bye-bye.
You're listening to Misunderstanding Dementia Podcast. This episode is brought to you by Misunderstanding Dementia Course, and you can put in 50 to get a 50% discount on the course. Thank you.